You may have heard some of the stories about patient information getting into the wrong hands, like the computer records that were accidentally put on a public website, or patients' paper records that went flying into the air when a hospital worker accidentally dropped them as she was getting out of the car. Hipaa, H-I-P-A-A, is the Health Insurance Portability and Accountability Act. It's a federal law put in place in 2003 to protect the privacy and confidentiality of health records. The Hipaa privacy rule for the first time creates national standards or values to protect individual medical records and other personal health information. Any patient information you see, hear, or read through your paid or volunteer job is considered private information. It's important that all volunteers and employees hold all patient information and all aspects of patient identity in strict confidence. Hipaa protects information in all forms: written records on paper, computer data, and even spoken information. Hipaa gives us a set of guidelines and rules for protecting patient information. It is designed to rebuild and increase trust with patients. You, as an employee or volunteer, are ethically bound to keep patient information private, even after you are no longer employed or volunteer with your healthcare organization. Privacy of patient information is not new, but Hipaa put a spotlight on privacy and confidentiality. Hipaa has four main objectives. First, and most importantly, it is intended to protect the patient's right to privacy. Secondly, Hipaa protects any information about a patient's physical or mental health condition that could identify a patient. Third, it gives more control to the patients regarding how their information is used and to whom it is given. Finally, it looks at who has the right to see patient information. A very important aspect of Hipaa is what is referred to as minimum necessary.
Hi, Allison.
Hi, Lori.
I took Mary Jones to her appointment, and she stayed in the hospital. What's wrong?
Well, I know you guys have become really good friends over the years. I bet she'd really appreciate a visit from you.
Okay, thanks.
Yeah.
Bye-bye.
Allison handled this properly. Volunteering or working for a healthcare organization does not automatically give a person the right to know confidential information about a patient. Minimum necessary means healthcare workers and volunteers can have only the information they need to get the job done. It is important to remember that some patient information cannot be shared with you, so don't get upset or offended if all of your questions cannot be answered. It's not that someone is trying to hide anything. They are just following the Hipaa regulations and respecting the patient's right to privacy.
Hey, Tom, did you hear that Mildred's in the hospital? She had a heart attack, and they're not sure if she's going to live or die. She's over at St. Pete's in an intensive care unit on a respirator.
This is a clear violation of patients' rights and Hipaa regulations. Hipaa emphasizes that staff should not be talking about a specific patient in a place where others can overhear the conversation. Always consider where you are when discussing a patient. Conversations with patients and families about any aspect of care should not take place in lounges, hallways, in public places, or rooms where others are present. Also be aware that when using cell phones, information can be listened to with electronic scanners similar to police scanners or two-way radios, or overheard by others in the area. So what if you overhear private patient information, or you become aware that a patient's privacy has been violated? What should you do? First of all, respectfully let the person speaking know that you can overhear the conversation. It's also important, if you know there's been a breach of confidentiality, to report it to your supervisor or volunteer coordinator. Be aware of potential problems and take steps to avoid them before they happen. Hipaa has imposed sanctions or punishments for employees and volunteers who do not properly protect patient information, including both civil and criminal penalties. You are duty-bound to report any known or suspected breaches of confidentiality without fear of revenge or retaliation.
Mrs. Smith, I've got a letter here from your daughter. How about if I read it for you, since I know it's hard for you to see sometimes?
Oh dear, I get so, Allison, I get so depressed at times, and it has for an awfully long time. And at once I was in a psych ward.
I'm sorry to hear that. How about if I read this letter from your daughter, and then I'll go find somebody that you can talk to?
That'll be fine.
Okay.
Appropriately, when the patient gave Allison the opportunity to talk about information she did not need to do her job, Allison avoided the subject instead of asking additional questions. Hipaa does not restrict the information a patient tells you about herself. It may be more helpful to the patient, however, to learn simple ways to change the subject so that the patient doesn't reveal information that they may later regret. If the patient does share information with you, remember that it is important that you keep this information confidential. Don't share it with friends or family.
Hi, Cheryl. I heard your aunt was in our facility.
It is important not to discuss the patient's identity or condition outside of work. Even though your intentions are good, the patient may not want your friend to know about her health problems. Never disclose to another patient any information about others that may be receiving help or service from you or from your organization. Think of yourself as the patient. Who would you want knowing all of your private health information? Hipaa gives several specific rights to patients. These rights are explained to the patient when they are admitted and are included in a form called Notice of Privacy Practices. The patient has the right to keep their health information private. What would you want others knowing regarding your health information? Very few people deliberately and cruelly violate patient privacy and confidentiality. More likely, it's a result of unintentional carelessness. But the heightened sensitivity Hipaa brings to the issue of privacy makes it even more important that we keep all information about our patients confidential. Why should you care about patient privacy? Because we are ethically and morally bound to protect patient information. In healthcare, it has been our responsibility to protect health information for over 2,000 years. Because not caring and then breaching confidentiality could get us into a lot of trouble, including losing our job or volunteer position. Healthcare is a service industry that relies on information for every aspect of delivery. By nature, healthcare workers and volunteers are very caring, but every day we face situations where confidentiality can be compromised. Mental health, substance abuse, and sexually transmitted diseases create a heightened awareness of the need for privacy. Most of the time when confidential information is leaked, it's unintentional or accidental, but intentionally or unintentionally, violations of privacy have increased. The need for health care does not justify unnecessary invasion into the patient's life. Hipaa is not something to ignore, but it's also not something about which to become panic-stricken. All healthcare workers and volunteers need to be consciously protective of our patients' right to privacy. Hipaa expects a good faith effort to protect patient confidentiality and privacy. Your organization has already had a confidential policy in place, mandated by other laws similar to the Hipaa standards. Providing care means taking on the responsibility of keeping information private. We've known we should do this for a long time. If you are unclear about what this means to you, or if you have questions or concerns about your responsibility regarding Hipaa, ask your supervisor or volunteer coordinator about your policies and procedures on privacy and confidentiality. You can also visit the Acorns End website for other videos and information at www.acornsend.com.